What if the subtle signs your body sends could be clues to something more serious, like colon cancer? Every day, our bodies communicate with us through symptoms and sensations, often whispering warnings of potential health issues. Recognizing these signs early could be the key to effective treatment and recovery. Colon cancer, for instance, often presents subtle symptoms that can be easy to overlook. Paying attention to these signs can enhance our understanding and potentially save lives. With knowledge as our guide, we can navigate the complexities of this condition. Now, let's explore the alarming signs of colon cancer that you can't afford to miss, ensuring you're informed and prepared to take action. Number 1. Change in bowel habits. One of the most common early signs of colon cancer is a noticeable change in bowel habits that persists over time. This symptom can manifest as sudden, unexplained shifts between diarrhea and constipation, or changes in the consistency, shape, or color of your stool. Such irregularities should be taken seriously, as they might indicate that something is obstructing or altering the function of the colon. For many, these changes are accompanied by a feeling of discomfort or an inability to completely empty the bowel. If you notice that these changes last for more than a few days, it is crucial to consult a healthcare professional. Colon cancer can cause changes in the bowel due to the growth of tumors, which may block parts of the colon, affecting how waste moves through your digestive tract. This disruption can lead to the symptoms described and may also include more specific signs, such as stools that are narrower than usual or consistently loose. While these symptoms can be indicative of less serious digestive issues, when they persist, they warrant professional evaluation to rule out colon cancer, especially if you are over 50 or have a family history of the disease. Early detection through attentive monitoring of changes in your bowel habits can significantly enhance the effectiveness of treatment, potentially leading to a better prognosis. It's important to maintain regular screenings and to report ongoing changes to your doctor, as this vigilance can be life-saving. Number 2. Rectal bleeding or blood in stool. Seeing blood in your stool can be alarming and is not something to ignore. Bright red or very dark blood can indicate rectal bleeding, which, while often caused by hemorrhoids, can also be a symptom of colon cancer. Such bleeding might occur as a tumor in the colon or rectum bleeds, or as the cancerous growth causes changes to the tissue that lead to blood loss. It's crucial to report these symptoms to your doctor, as early detection can significantly impact the effectiveness of treatment for colon cancer. Blood in the stool can appear on the toilet paper, in the water of the toilet bowl, or as streaks on the stool itself. Sometimes, blood from higher up in the digestive tract may cause stool to appear black and tarry. While it's possible that these signs come from non-cancerous sources like anal fissures or inflammatory bowel disease, they must not be dismissed. A doctor can conduct a series of tests, such as a colonoscopy or a fecal occult blood test, to determine the cause of the bleeding. It's particularly important to pay attention to this symptom if accompanied by other warning signs of colon cancer, or if you have a family history of the disease. Maintaining regular screenings, especially if you are over 50 years of age or at increased risk due to family history, is crucial. Detecting colon cancer early is key to successful treatment and can save lives, making vigilance and prompt action essential. Number 3. Persistent abdominal discomfort. Experiencing persistent abdominal discomfort such as cramps, gas, or pain can be more than just a minor nuisance. It may indicate a serious health issue like colon cancer. These symptoms can vary in intensity and often mimic less severe digestive problems, making them easy to overlook. However, if the discomfort is ongoing and doesn't seem to resolve with basic dietary changes or over-the-counter treatments, it warrants a closer look by a healthcare professional. This type of pain or discomfort can occur when a tumor in the colon grows large enough to affect bowel function, leading to blockages or changes in bowel habits. It may also cause inflammation in surrounding tissues, which contributes to discomfort. Regular screening, such as colonoscopies, is recommended for early detection, particularly for individuals over 50 or with a family history of colon cancer. Additionally, younger individuals experiencing these symptoms should not dismiss them, as colon cancer rates in younger populations have been on the rise. Documenting when the discomfort occurs, along with any other symptoms such as changes in stool or unexplained weight loss, can provide crucial information for your doctor. By catching colon cancer in its earlier stages, treatment can be more effective, potentially leading to a better outcome. Therefore, paying attention to persistent abdominal discomfort and seeking medical advice promptly are essential steps in maintaining not only digestive health, but overall well-being. Number 4. Feeling that your bowel doesn't empty completely. Constantly feeling that your bowel hasn't completely emptied after a bowel movement can be a subtle yet significant sign of colon cancer. This sensation, often described as an ongoing discomfort or the feeling of a blockage, is known as tenesmus. It occurs when a tumor within the colon partially obstructs the bowel, making it difficult to fully evacuate the contents. Although this symptom might be mistaken for other common gastrointestinal issues, such as irritable bowel syndrome or inflammatory bowel diseases, its persistence is a key indicator that something more serious could be underlying. It is crucial to monitor this symptom and discuss it with a healthcare provider who can perform the appropriate diagnostic tests, such as a colonoscopy, to ascertain the cause. Early detection of colon cancer significantly enhances treatment efficacy and outcomes, making it imperative not to ignore such warning signs. In addition to feeling that the bowel does not empty completely, other accompanying symptoms might include changes in the frequency or nature of bowel movements, abdominal pain, and rectal bleeding. These signs, particularly when experienced together, warrant prompt medical evaluation. Addressing these symptoms early not only aids in diagnosing potential colon cancer, but also helps in ruling out other possible conditions. By being vigilant about bowel health and seeking medical advice when changes occur, individuals can take crucial steps toward protecting their overall health and well-being. Number 5. Weakness or fatigue. Experiencing unexplained fatigue or weakness can be an easily dismissed yet critical warning sign of colon cancer. This type of fatigue isn't alleviated by rest and isn't necessarily linked to overexertion. It's a pervasive tiredness that can significantly impair daily activities. The reason behind this symptom in colon cancer cases is typically due to the cancer's impact on the body's ability to produce healthy red blood cells, leading to anemia. This reduction in red blood cells means the body cannot transport sufficient oxygen, resulting in persistent fatigue. Additionally, if the cancer is causing hidden bleeding in the colon, the loss of blood can further decrease red blood cell counts, exacerbating feelings of weakness and fatigue. It's important for anyone experiencing such symptoms to consult with a healthcare provider who can perform blood tests to check for anemia and other markers that might indicate the presence of cancer. These symptoms are not exclusive to colon cancer and can be indicative of a range of medical conditions, but if they are new, persistent, and unexplained, they should not be ignored. Early intervention and identification of the cause can be crucial. Diagnosing colon cancer early significantly improves the likelihood of successful treatment, highlighting the importance of paying attention to subtle signs like unexplained fatigue. Regular checkups and discussing any changes in your health with your doctor are essential steps in maintaining health and detecting potential issues before they develop into serious problems. Number 6. Unexplained weight loss. Unexplained weight loss can be a troubling sign, especially when it occurs without any changes in diet or exercise. This symptom is often associated with various health conditions, including colon cancer. When significant weight loss happens unexpectedly, it could suggest that the body is not absorbing nutrients effectively, possibly due to a malignancy in the colon. Such cancer can interfere with the digestive system's ability to process and extract nutrients from food, contributing to weight reduction. Additionally, tumors in the colon may cause inflammation and increase the body's metabolic demands, which can also lead to a decrease in weight. If you notice that you are losing weight inexplicably, it is crucial to consult a healthcare provider who can perform comprehensive diagnostic tests, such as blood tests and colonoscopies, to identify the underlying cause. Early detection of colon cancer through recognition of symptoms like unexplained weight loss is key to effective treatment. Furthermore, diagnosing colon cancer before it spreads can significantly improve treatment outcomes and increase survival rates. It is essential to remember that while unexplained weight loss is a potential sign of colon cancer, it can also be indicative of other medical issues, making prompt medical consultation vital. Number 7. Iron deficiency anemia. Often overlooked as a mere dietary issue, iron deficiency anemia can actually be a telling symptom of a more severe condition, such as colon cancer. This form of anemia arises when the body lacks sufficient iron to produce the hemoglobin necessary for red blood cells to effectively transport oxygen. In cases of colon cancer, anemia often results from chronic unseen bleeding within the gastrointestinal tract. This bleeding can be so minimal that it goes unnoticed, yet persistent enough to deplete iron stores over time, leading to significant anemia. The presence of such symptoms warrants thorough investigation, typically starting with a fecal occult blood test to check for hidden blood in the stool, followed by more detailed diagnostic procedures like a colonoscopy if necessary. Recognizing iron deficiency anemia as a potential indicator of colon cancer is crucial because it can lead to early diagnosis and treatment, significantly improving the prognosis. Patients experiencing symptoms of anemia such as persistent fatigue, paleness, shortness of breath, or heart palpitations should consult their doctor for a complete evaluation to determine the cause and appropriate treatment. While iron supplements might alleviate some symptoms of anemia, addressing the root cause is essential, particularly if it involves a critical condition like colon cancer. This approach ensures that underlying issues are not merely masked, but are thoroughly treated, enhancing overall health and potentially saving lives through timely medical intervention. Number 8. A feeling of fullness. Experiencing a persistent feeling of fullness, despite not eating much, is a symptom that may point toward colon cancer, particularly when accompanied by weight loss. This sensation of satiety can misleadingly appear benign, but it's crucial to recognize it as a potential warning sign. The condition, medically termed as early satiety, can occur when a tumor in the colon occupies enough space or causes enough irritation that it affects normal digestive processes. This might lead to feeling full after eating only a small amount of food, or sometimes even without eating at all. It's essential to understand that this isn't merely about discomfort. It could be a signal from your body indicating something more serious. When the digestive system is compromised by the presence of a tumor, not only is the sensation of fullness affected, but it may also impact how nutrients are absorbed and processed, contributing to weight loss and general malnutrition. If this symptom is persistent, it is advised to seek medical evaluation promptly. A healthcare provider can perform a series of diagnostic tests, including imaging and scopes, to determine the cause. Early detection is key in treating colon cancer effectively, as it increases the range of potential treatment options and improves overall outcomes. Addressing symptoms early by consulting with a medical professional can lead to significant health benefits and could potentially be life-saving. Remember, being attentive to what your body is telling you and taking timely action is crucial for maintaining health and well-being. Number 9. Bright red or dark blood in stools. Discovering bright red or very dark blood in your stool is a symptom that should never be ignored, as it can be a significant indicator of colon cancer. This type of bleeding might appear on the toilet paper after you wipe, or you might notice it directly in the bowl or on the stool itself. Bright red blood typically suggests that the bleeding is occurring in the lower part of the gastrointestinal tract, such as the rectum or anus. In contrast, darker blood, which can appear almost black, often indicates bleeding from higher up in the colon or small intestine. This symptom is alarming because it points to possible damage or changes to the tissues in the colon, which could be due to the growth of a tumor. When blood is noticed in the stool, it's critical to contact a healthcare provider promptly for evaluation. The tests they may perform include a fecal occult blood test, which can detect small amounts of blood that aren't visible to the eye, or a colonoscopy, which allows the doctor to view the inside of the colon directly and identify any abnormal areas. It's also possible that bleeding could be caused by conditions other than cancer, such as hemorrhoids, inflammatory bowel disease, or diverticulosis, which further emphasizes the importance of a thorough diagnosis. Understanding and acting on this symptom is essential not just for diagnosing colon cancer, but also for ensuring it's caught at an early stage when treatments are most effective. Prompt medical attention to bleeding in the stool can lead to better health outcomes and peace of mind. Number 10. Nausea or vomiting. When you repeatedly face nausea or episodes of vomiting without an apparent reason, it could be a red flag for a condition as grave as colon cancer. These symptoms, often overlooked or attributed to less severe health issues, might indicate a disruption in the lower digestive tract caused by a tumor. Such obstructions can interfere with normal digestive processes, leading to discomfort and the urge to vomit. Recognizing these signs and consulting a healthcare professional is crucial. particularly if the symptoms are new or have intensified suddenly. To diagnose the underlying cause, your doctor may suggest a range of tests, including blood panels and imaging procedures like MRI or CT scans, which help in identifying any abnormal growths in the digestive system. A colonoscopy might also be conducted to visually inspect the colon for tumors. Early detection through these diagnostic methods can greatly improve the effectiveness of treatment for colon cancer. While it's common to dismiss nausea and vomiting as symptoms of conditions like food poisoning or stomach flu, persistent issues warrant a more thorough investigation to rule out serious conditions such as colon cancer. Number 11. Unexplained pain or aches. Persistent pain or discomfort that lingers without an obvious reason could be more than just a simple ache. It might be an early indicator of colon cancer. When you experience such symptoms in areas like the abdomen, back, or other parts of the body, and they don't seem to dissipate, it's important to take them seriously. Colon cancer can cause pain due to tumors pressing on surrounding tissues or due to a partial obstruction in the bowel, which can lead to cramping and discomfort. This type of pain often varies in intensity and might not correspond directly to obvious triggers, like eating or physical activity. If you find yourself facing persistent, unexplained pain, consulting with a healthcare provider is a prudent step. They may suggest diagnostic tests such as abdominal ultrasounds, Connecticut scans, or MRIs to look for signs of abnormal growths and to assess the overall health of the colon and the surrounding organs. Additionally, a colonoscopy may be performed to directly observe the inner lining of the colon, allowing doctors to identify any malignant changes or obstructions. Addressing these symptoms promptly not only helps in potentially diagnosing colon cancer at an early stage, where treatments are usually more effective, but it also rules out other possible causes of your discomfort. Ignoring ongoing pain can lead to complications and might diminish the effectiveness of treatment options later on, so it's vital to act swiftly and seek medical advice. Number 12. Changes in appetite. A noticeable decrease in appetite or difficulty eating can be a concerning symptom, and in some cases, it points towards colon cancer. When you find yourself feeling less hungry than usual over a prolonged period or struggling to eat the amounts you normally would, it's crucial to consider a consultation with a healthcare provider. In colon cancer, changes in appetite often stem from the cancer's impact on the body's ability to process and absorb nutrients effectively. Tumors can physically obstruct parts of the digestive tract or release substances that alter metabolism, leading to a reduced desire to eat. These changes are not just disturbing because they affect your eating habits, but they also pose a risk of significant weight loss and malnutrition, which can further complicate health. Diagnostic evaluations such as blood tests, imaging studies like CT scans, and gastrointestinal examinations including colonoscopies are essential tools that doctors use to investigate unexplained changes in appetite. These tests help to rule out or confirm the presence of tumors and assess the extent of any potential cancerous growths. Prompt attention to such symptoms allows for the early detection of colon cancer, increasing the likelihood of successful treatment and recovery. Therefore, experiencing a sustained change in how much you want to eat should not be ignored. By addressing this early with your doctor, you ensure that you are taking a proactive approach to your health, potentially catching serious conditions like colon cancer before they progress. As we've uncovered today, being aware of the warning signs of colon cancer can make a significant difference in early detection and treatment. Thank you for joining us on Edge of Health, where we're committed to keeping you on the forefront of what you need to know about your well-being. If you found this information useful, don't forget to like, subscribe, and share this video to help spread awareness. Stay informed and stay healthy.